It starts quietly, just a few chicks looking dull, then suddenly your flock crashes, mortality spikes, production dreams collapse, and you're left asking, what went wrong? Today, let's talk about one of the most devastating diseases in poultry production, Gumboro disease, also known as infectious bursal disease, IBD. This is not just another infection, this is a virus that targets the very foundation of a bird's immune system. Gumboro is an acute, highly contagious disease that mainly affects young chicks between 3 to 6 weeks of age. And what makes it particularly dangerous is its target, the bursa of Fabricius, the organ responsible for developing the bird's immune system. Once the virus hits, it destroys this organ, and with it, the bird's ability to defend itself. Now here's the scary part. The disease runs fast. Within just 7 days, the entire course is completed, with peak mortality hitting around day 3 to 4. That means you can go from a healthy-looking flock to massive losses in less than a week. The virus doesn't stop at the bursa. It also affects other lymphoid tissues like the thymus and spleen, further weakening the bird's immunity. And if you're thinking you can easily eliminate it from your farm, think again. This virus is extremely tough. It can survive for months in the environment, hiding in litter, equipment, and housing. Once your farm is contaminated, it becomes a long-term battle. Transmission is mainly horizontal, from bird to bird through contaminated feed, water, and environment. There's no strong evidence of transmission from hen to chick, but once it enters your flock, it spreads rapidly. Now, what do you actually see in your birds? The incubation period is very short, just 2 to 3 days. You'll notice chicks becoming dull, depressed, and refusing feed. Their feathers become ruffled. Then comes a very peculiar sign, vent pecking, often leading to a blood-stained vent due to inflammation of the bursa. Diarrhea follows, usually whitish or yellow and sticky. Birds begin to tremble, become weak, and you'll often find them huddling in corners or around drinkers. Morbidity is extremely high, sometimes up to 100%, and mortality can range anywhere from 10% to 90% or more, depending on the strain, environment, and management. And if that's not enough, immunosuppression sets in. This means your birds can no longer fight off other infections. Vaccines you've given may no longer work effectively. Secondary bacterial and coccidial infections take advantage, and things spiral quickly. On post-mortem, you'll typically see hemorrhages in the muscles, especially the thighs and breast, and sometimes in the proventriculus. Diagnosis in the field is often based on history, clinical signs, and these lesions, although lab confirmation is always ideal. So, how do you control something this aggressive? It comes down to 3 pillars: biosecurity, disinfection, and vaccination. But let's be clear, there is no cure for the virus itself. Treatment is only supportive. We use antibiotics and coccidiostats to control secondary infections. And importantly, we avoid sulfa drugs because they can worsen bleeding and damage the kidneys. Instead, safer options like Improlium are preferred. Now, a critical warning, something many farmers get wrong. Do not give disinfectants to birds to drink. It might sound like a quick fix, but it actually causes more harm than good. Disinfectants can damage the gut lining, reduce nutrient absorption, worsen diarrhea, affect egg production later, increase stress in already sick birds. And most importantly, they do not kill the virus inside the bird. Some, like phenols and formaldehyde-based products, can even cause serious toxicity and organ damage when ingested, so instead of helping, you end up making the situation worse. In the end, Gumboro is a disease of prevention, not treatment. Strong vaccination programs, strict biosecurity, and good farm hygiene are your best defense, because once this virus enters your flock, it doesn't just cause disease, it destroys immunity, productivity, and profits. And by the time you realize it's Gumboro, it may already be too late.